Compared to the other side, does it hurt more when I press down hard on the left? Have you ever injured your foot? Ever sprained your ankle? Have you ever had an injury or fracture on the right side? Ah, this is a muscle injury. Okay, let me check your eyes. Look up. He's very anxious. His eyeballs are already out of control. When he tries to look at something up close, his eyes jump away as they move toward the center. And when he tries to focus on something far away, as soon as his eyes come back to the center, they jump away again. So here's the thing. Fixation is the brain's most advanced function. In other words, if you can't control your eyeballs, if you can't control your eye movements, then you lack the ability to fixate. That means your attention span isn't sufficient. If you want to focus on something, you need to keep your eyes fixed on it. Only then can you concentrate. So someone who can't control their eye movements simply can't focus. It means you can't control your own muscles. You can't control your own muscles. So if you want to perform a movement really well and keep it on a fixed trajectory in a single plane, that's actually quite difficult. Next, I'll have him practice. Do you usually lift weights? It's been a long time since I lifted weights. What about before? Ah, what do you like to train? Chest, shoulders, back, legs, arms, waist. After you recover, what movements do you want to do? I'm asking, what do you like to train? Ah, I like training chest. Looking at the equipment here, there's only this one that can train chest. Have you ever done a chest fly before? Try it for me. Let me see. Just do it as you normally would. Let me see. Before he starts, let me ask everyone a question to think about. When doing a chest fly, do you think my grip is using the force of a curl, or is it more like a pushing motion, or is it more like a pressing motion, or is it more like a pulling motion, or is it more like a spreading motion? Think about it for a moment. Let me first see how you used to do it. Okay, good. Next, I'm going to teach him how to do this movement. While doing this exercise, it's not just about training his pectoralis major. My goal is to find a way to help him push out his posterior mediastinum. However, he has a problem. His wrists are very unstable. They keep shaking because he hasn't specifically trained them before. So, in this situation, if we want to push out the posterior mediastinum, his hands must be steady first. Only then can the force be transferred to the posterior mediastinum. So I can teach him a method for this. Other methods aren't really suitable for him to grip like this. He can't control it. So at this point, I can have him place his hands on top like this. That way, the requirement for wrist stability isn't as high. When he does this movement, he makes a lot of mistakes. But since we're not training muscles right now, I'm just trying to push out the posterior mediastinum. I'm not going to correct his form for now. Instead, I'll first guide him to adjust his posterior mediastinum and see if his heart rate can go down. Now let me show you how to grip it, okay? When you're sitting here, if you grip it like this, your wrist won't slip as easily. And then when you squeeze like this, your thoracic spine and the back should be supporting you, but I'll have you coordinate it with your breathing. Generally, it goes like this. If you want to lower his heart rate, bring it down. It's exhaling that can lower his heart rate, right? Inhaling raises the heart rate, so generally, taking a deep breath and holding it will make the heart rate go up. After exhaling and holding your breath, that's when the heart rate goes down. But if I take a deep breath and hunch my chest like this, when you take a deep breath and hold it, isn't the force pushing outward from the inside? The force pushing the posterior mediastinum outward is relatively strong, right? After I exhale, the chest cavity is empty, so there's no force pushing the thoracic curve backward, correct? But during exhalation, due to the linkage, the thoracic spine is in flexion, right? So at this point, you're faced with a choice. Do you want the member to take a deep breath and hold it with their legs? Or do you want them to hold their breath and push with their legs at the end of exhalation? There's one more thing I want to remind you. Performing the movement while holding a full breath always allows you to use more weight than holding your breath after exhaling. Do you agree? Right, this is pretty straightforward, isn't it? Because with a full breath, I'm more stable. So at this point, many people, to play it safe, will choose to hold their breath after exhaling. I wouldn't do that. I would have them take a deep breath and hold it. But if you don't execute it properly, it can have the opposite effect. What do I mean by opposite effect? It means that after training, their heart rate is even higher than before. So why still choose to take a deep breath and hold it? Because at this point, the pressure pushing outward from the inside on the posterior mediastinum is quite high, and the pressure pushing outward from the inside on the chest is also quite high. At this point, no matter how much weight I add, the counterforce is also important here. So, even though this exercise increases the heart rate, because during the exercise the chest is pushed outward and the compression of the posterior mediastinum is improved after standing up, when the heart rate drops to its lowest, it will actually be lower than it was before the exercise, even though it had been higher earlier. This lower heart rate isn't due to a decrease in volume, but rather because the compression of the posterior mediastinum has been relieved. However, in reality, the movement I'm practicing is actually making the heart rate higher. In other words, when he holds his breath and practices with his chest full of air, his heart rate will exceed 150, which is higher than when he's just standing. The more he inhales, the more excited his sympathetic nervous system becomes, and on top of that, I'm adding such a heavy load. And I keep him stuck in the inhalation position the whole time without letting him exhale, because only when he exhales will his heart rate drop. So it's possible that while he's doing this movement and I'm having him hold his breath, his heart rate could shoot up to 170, 180, or even 200, but that's not what I'm aiming for. What I want is to see whether, after he finishes and stands down, his heart rate can drop below 150. That's what I'm looking for. But if you have him take a deep breath and hold it, yet he doesn't apply the force to the posterior mediastinum and doesn't push it out, then as he squeezes forward and exerts force, he ends up puffing out his chest again. At this point, it's even more compressed, so you'll see two possible outcomes. After doing it this way, the resting heart rate might go from 150 up to 160. In other words, you've made it worse. So when you're making your choice, you need to be confident. You need to be sure that you can teach him to apply the force to the posterior mediastinum, and only then have him take a deep breath and hold it. Otherwise, after you finish, his heart rate won't improve. It'll only get worse. So there's a certain risk involved. I'm telling you first about the pros and cons of both approaches. If you suddenly have him hold his breath, even if he doesn't apply the force to the posterior mediastinum, his heart rate will still decrease. Because you've kept him at the exhalation position the whole time, but this decrease is only temporary. It will quickly rise again. However, if I relieve some of the compression on the posterior mediastinum and his heart rate drops, then he can maintain that because his sympathetic nervous system won't be so easily stimulated anymore. The pressure from the sympathetic nervous system is reduced a bit. Okay, that's the choice for breathing. I'll tell you what I would choose. Because I like a challenge, I would choose to have him take a deep breath and hold it while sitting. I don't know if he can perform the movement I teach, but I'll do my best to get him to do it. All right, so the movement becomes like this. I sit here, and when I inhale, I do it like this. I first exhale completely. Try to make your exhale as long as possible, but don't deliberately contract your abdomen or interfere with your breathing. At the end of the exhale, lift your pelvic floor. Just engage your superficial pelvic floor muscles, then hold your breath and keep it here. And during the contraction, don't tilt the back of your head backward and let your thoracic spine curve slightly backward. And when you squeeze, make sure to always apply a forward pushing force as you contract. This way, your posterior mediastinum will move backward. Don't just squeeze directly like this. Yes, always push forward as you contract. It is just like a piece of protective armor, and that is it. All right, hold your breath and do as many as you can. I'll set it for you. You haven't practiced in a long time, right? Then let's use 25. Don't be afraid. Raise the chair a bit higher. Put your hand on it for a moment. Let me see where it is. Back. Stop adjusting, just raise your feet a bit more, and that should be enough. All right, you can put your hand down now. Hold on to the chair, okay? Yes, lower your head and round your shoulders, then exhale completely at this position, and then inhale fully. First exhale completely, then engage your pelvic floor muscles, and then inhale fully. All right, just hold your breath, and you can do it. Grip tightly. You can't squeeze it through, let go, let go, let go, because the elbow is a bit valgus. I don't dare to apply too much force. After the arm is straightened, the forearm is here. Just upgrade a bit. Did you see that? Did you see the bench? For members like this, it's especially hard to train their biceps and triceps. It's really difficult for him to train those muscles. His arm, even when we keep it straight, his forearm still turns outward like this. So when he does bicep curls, he can't get the dumbbell to align with his biceps. It's harder for him. This way, it's easier to target the bicep. In this position, it's difficult for him to train both his biceps and triceps. Using some special methods can help him improve this issue, and actually, he's very well suited for this. Why is it that the more you tuck your arms in, the more his forearms turn inward? So you can understand that for him, gripping like this makes it hard to feel his chest working. This way, it's actually easier, and it also helps correct his elbow flaring issue. This method suits him perfectly. I'll have him do 2 exercises, 1 chest fly and 1 rowing movement. Then let's see if we can help lower his breathing rate and heart rate. 1, 2, 3, sit. That's right, don't hesitate. Keep your head up and look forward. Push forward, that's right. Yes, keep your back pressed against the pad, don't let it come off. 4. This one felt a bit empty. Hold it at the top, that's right. Okay, take a breather. Not bad at all. At this point, his heart rate will be very high because he can't catch his breath, and I had him take a deep breath before doing the other set. Let me check the heart rate monitor. Why do I need to check this? It's to prevent him from maxing out. If he maxes out, meaning his heart rate goes above 200, that's dangerous. Actually, it's still okay. His respiratory rate has reached 25. Just now it was 33. Now his blood oxygen saturation is 99, and his heart rate is 128. Heart rate 128. He looks like he's more out of breath than before. But why did his heart rate go down? Because there's now a bit more space in the back of his lungs. In a moment, I can have him stand up. After I finish training, I'll have him stand. Right now, I'm not looking for the lowest value. I'm worried about it going above 200, which would be dangerous. I need to decide how long he should rest. Now he can go straight into the final exhalation with pelvic floor contraction at the end of the breath out. Then inhale. That's right. Try to inhale as much as possible to the back and see if you can do 10 reps. Keep your chin up, chin raised. That's right. Very good. Push forward, squeeze for 3 reps. 4, 5, 6. Two more for these 2. Place 1 even further back and squeeze. Okay? Good. Take a break. Stand in the middle to rest. Don't sit down because I want to check your sweat while you're standing. All right, I'll let you know. A good workout, if you're training effectively, will make your throat sweat, your body sweat, but the sweat on your hands will be gone. The most concerning situation is when your whole body doesn't sweat, but only your hands and feet do. When your whole body doesn't sweat and only your hands and feet do, people like this tend to have a startle reflex. Their hair stands on end easily, they get goosebumps, their pupils dilate frequently, and they look very frightened. This is a very typical sign of sympathetic nervous system excitement. All right, in this position, I want to observe his heart rate as it comes down. Although his rest time isn't quite enough yet, I still want to check normally. Then for the second exercise, I'll have him do a seated row. Right now, his breathing rate is 2. 4, and then his heart rate is 119. But as for his heart rate, as long as it goes over 100, it turns orange. What I want is to train him until it's green, which means I want to get it below 100. First, I want to get his heart rate below 100. What is the normal requirement? Normally, for someone his age, the heart rate should be around 70, a bit over 70, but not over 80. He went straight up to 110 or 120, which is actually not bad. Right now, it's 107, but it can't go any lower. 107 is the lowest. Then it goes up to 108, 111. So, let's do the second exercise and see if I can get his heart rate below 100.